Can we have Dr. Ramamurthy on this talk on presbyopic correction beyond the rings?
Thank you. I'm going to be talking about a relatively new lens in the Indian market. We all are adapting to multifocals, but we are also aware of the significant compliance of blurred vision for both far and near, reduced contrast, night halos, glare, ghost images, monocular diplopia. So though our patients constantly aspire for freedom from glasses, we are not able to give it to them without certain compromises that they have to live with. And not all patients end up being happy. Is there a solution to address this? Very recently, I have started using in the last 6 months or so, the Mini-Well, which is essentially an extended depth of focus lens. The Mini-Well, the expansion is that it's called Mini-Well Ready. Mini incision wavefront engineered leading lens, and it's ready to use because it's preloaded. It's manufactured by SIFI, and the interesting part was it's a totally different optics from what we are used to with the diffractive multifocals. And basically why it's called wavefront engineered is it plays around with the spherical aberration. The spherical aberration is induced in the central pupil and control of the higher order aberration in the periphery of the pupil, because of which it seems to achieve the presbyopia correction. And essentially we all know that spherical aberration is nothing but the rays of light which are paraxial or close to the central axis, being brought to a focus a little behind, and the rays of light which is in the periphery brought to focus in front. So because of the spread of focus is what is utilized in a very scientific manner to create multifocality with this particular lens. The unique distribution of this lens is not, there is no diffractive rings, there's just some zones. Even in these zones, there is no difference in the intraocular lens power per se. The basic power remains the same. The D3 is the area, that's the outside area, which is about 3 millimeters, is monofocal. And the D2 has negative spherical aberration, and the D1 has positive spherical aberration. And essentially, even the amount of spherical aberration in the D1 and D2 would depend upon the basic power of the intraocular lens per se. And these three distinct areas, it has 4 haptics, which gives extreme stability to the lens. Because of this negative and the combination of negative spherical aberration and an aspheric area, there is a spread of focus, and this is supposed to function similar to a multifocal intraocular lens without the compromise as far as the quality is concerned, because there are no diffractive rings, there is no zonal progressive pattern as we used to see in the rezoom lenses, etc. What about the performance of these lenses? It's supposed to be excellent for distance. Studies have shown that it is excellent for distance and intermediate vision. As you can see, it is in the area logmar 0.00 to 0.1. And when it comes to near vision, it comes to about 0.3 logmar vision. And that again is reasonably good quality vision as far as 33 centimeters is concerned. And most of the normal reading material that we are used to is quite comfortably dealt with this. So what essentially this lens promises is excellent distance and near vision with the intermediate vision, with functional near vision, and without any compromise as far as the quality of vision is concerned. If you compare it with the Symphony, which was once upon a time before the trifocals came in and took over the markets, was one of my favorite lenses. You can see that this lens performs the orange line essentially corresponds to the Mini-Well. The orange line corresponds to the Symphony, and the blue line corresponds to the Mini-Well. As far as the distance vision is concerned, both are equally good. But when it comes to near vision, the Mini-Well seems to perform somewhat better than the Symphony per se. And if you compare it with the true trifocals, which give excellent near vision, distance, and intermediate, but at the same time, it comes at a cost of loss of contrast sensitivity, you find that again the performance is reasonably matching. As far as the distance vision is concerned, you find that all these, the more commonly used panoptics, the AT LISA, as well as the Mini-Well seems to function quite well. When it comes to intermediate vision, you find that the Mini-Well seems to score over these trifocal lenses. When it comes to true near vision, then the trifocals definitely perform a little better, but then only marginally better. Even with the mini-well, you get in the range of about 0.25 logMAR visual acuity, which is quite adequate for carrying on most of the normal activities that the patient might want. One other important factor of this lens is, unlike the other trifocal lenses where the light utilization is in the range of about 85 to 88%, here almost 94 or 95% of the light is utilized for formation of the image. And we know that the light which is lost, which is not focused, is essentially responsible for dysphotopsia, for the glare, halos, and other symptoms. And because 95% of the light gets utilized, again the loss in contrast as well as the symptoms of halos and glare is quite negligible, essentially because of the absence of rings in these lenses. Again, it comes in a preloaded platform, and there is because it's a central 2 millimeter, is a clear optic. Even if there is a mild tilt of the lens, or if there is a mild decentration of the lens up to about 0.5 millimeters, there's no compromise as far as the quality of functioning of these lenses. Studies have shown this, and this is essentially the characteristics of these lenses. It's a 10.75 millimeter optic with 4 haptics, and there is a toric version that's also available up to about 4.5 diopters in the lens, correcting about 3 diopters at the lens plane. And it has a unique double square edge pattern, because 2 square edges, something like a platform over here, because of which again the propensity to arrest PCO is significant. And then the IOL material is quite unique in the sense that it's a combination of hydrophobic and hydrophilic. It's not a coating on the surface, but it's a copolymer material which is got zero ionicity, because of which the lens is quite easily introduced even through a 1.8 millimeter incision. And then the incidence of glistenings, etc., is extremely low or absent. And there's a very reliable preloaded system that comes in the system. The time does not permit me to go into the details, but I usually introduce these lenses through 2.2 millimeter incisions. So there's minimal handling of these lenses and seems to work quite well. And what is this well fusion technology? Is it possible to extend this 0.2, 0.3 logMAR near visual acuity at the distance of about 40 centimeters to 33 centimeters? And yes, there's another lens called the mini-well Proxa, which instead of 3 rings has 5 rings. And again, there is a distribution as far as the ring segments are concerned. And both the central ring and the peripheral ring, basically it's a monofocal aspheric, while in the other 3 rings there is a combination of near and negative and positive spherical aberration. And this gives you a at power commensurate with almost plus 3.5 diopters, giving good vision as far as 30 centimeters is concerned. And what is this? Well fusion technology is to essentially implant a mini-well lens in the first eye and a mini-well Proxa in the other eye, so that bilaterally implanted right from without compromise in the quality of vision, the patient seems to have a good, excellent outcome. These are the mini-well Proxa and the mini-well toric intraocular lenses being implanted. And you can see that the mini-well, you can hardly see any rings over there, while in the mini-well Proxa, which has 5 rings, it's a little more evident. Very quickly, what are our results? We have done 37 eyes so far. And in all these eyes, whether we implanted mini-well Proxa, mini-well toric, the visual acuity was 20/32 or better, uncorrected visual acuity for distance, intermediate and near. And when we, 8 of these patients received well fusion, that is mini-well in one eye and mini-well Proxa in the other eye. And as you can see here, except for a couple of patients where 20/25 was the near vision, couple of eyes, the rest of the eyes, distance, intermediate and near, were all in the range of 20/20 once the bilateral uncorrected visual acuity. So obviously fairly satisfied patients. So I always used to believe that when you talk about multifocality, it has to come at a cost, at an expense of contrast sensitivity. But this seems to be an interesting concept, and we have implanted it in post-LASIK eyes, in high myopic eyes, for prelex. And as I mentioned, our experience is limited, just spread over the last 6 months, 47 eyes only so far. And 3 patients did complain of halos while driving. They are all patients who received mini-well Proxa in that particular eye, and which has 5 rings. But I do believe that as we go along, this is a significant addition to our armamentarium as far as our thrust for freedom from glasses is concerned. Thank you so much.
Thank you. Thank you very much. I think this lens is available now. From which company is this? Zydus? Or which
It's basically it's Italian company Sifi, and it's marketed by Zydus here in India.